A hospital is a healthcare institution providing patient treatment with specialized medical and nursing staff and medical equipment. The best known type of hospital is the general hospital, which typically has an emergency department to treat urgent health problems ranging from fire and accident victims to a sudden illness. A district hospital typically is the major healthcare facility in its region, with many beds for intensive care and additional beds for patients who need long-term care. Specialized hospitals include trauma centers, rehabilitation hospitals, children's hospitals, seniors hospitals, and hospitals for dealing with specific medical needs such as psychiatric treatment and certain disease categories. Specialized hospitals can help reduce healthcare costs compared to general hospitals. Hospitals are classified as general, specialty, or government depending on the sources of income received. A teaching hospital combines assistance to people with teaching to medical students and nurses. A medical facility smaller than a hospital is generally called a clinic. Hospitals have a range of departments and specialist units such as cardiology. Some hospitals have outpatient departments and some have chronic treatment units. Common support units include a pharmacy, pathology, and radiology. Hospitals are usually funded by public funding, health organizations, health insurance companies, or charities, including direct charitable donations. Historically, hospitals were often founded and funded by religious orders, or by charitable individuals and leaders. Currently, hospitals are largely staffed by professional physicians, surgeons, nurses, and allied health practitioners, whereas in the past, this work was usually performed by the members of founding religious orders or by volunteers. However, there are various Catholic religious orders, such as the Alexians and the Bond Seekers Sisters, that still focus on hospital ministry in the late 1990s, as well as several other Christian denominations, including the Methodists and Lutherans, which run hospitals. In accordance with the original meaning of the word, hospitals were originally places of hospitality, and this meaning is still preserved in the names of some institutions such as the Royal Hospital, Chelsea, established in 1681 as a retirement and nursing home for veteran soldiers. During the Middle Ages, hospitals served different functions from modern institutions in that they were almshouses for the poor, hostels for pilgrims, or hospital schools. The word hospital comes from the Latin hosps, signifying a stranger or foreigner. Hence a guest, another noun derived from this. Hospitium came to signify hospitality. That is the relation between guest and shelterer. Hospitality, friendliness, and hospitable reception. By metonymy, the Latin word then came to mean a guest chamber, guest's lodging, an inn. Hosps is thus the root for the English words host, hospitality, hospice, hostel, and hotel. The latter modern word derives from Latin via the ancient French Romance word hostel, which developed the silent s, which letter was eventually removed from the word, the loss of which is signified by a circumflex in the modern French word hotel. The German word Spital shares similar roots. Some patients go to a hospital just for diagnosis, treatment, or therapy and then leave without staying overnight, while others are admitted and stay overnight or for several days or weeks or months. Hospitals usually are distinguished from other types of medical facilities by their ability to admit and care for inpatients, whilst the others, which are smaller, are often described as clinics. A standard intensive care unit within a hospital, Uniclinicum Aachen in Germany, Tampere University Hospital in Tampere, Finland, All India Institute of Medical Sciences in Delhi, India, Lehigh Valley Hospital in Allentown, Pennsylvania. The best known type of hospital is the general hospital, also known as an acute care hospital. These facilities handle many kinds of disease and injury, and normally have an emergency department or trauma center to deal with immediate and urgent threats to health. Larger cities may have several hospitals of varying sizes and facilities. Some hospitals, especially in the United States and Canada, have their own ambulance service. A district hospital typically is the major healthcare facility in its region, with large numbers of beds for intensive care, critical care, and long-term care. In California, district hospital refers specifically to a class of healthcare facility created shortly after World War II to address a shortage of hospital beds in many local communities. Even today, District hospitals are the sole public hospitals in 19 of California's counties, and are the sole locally accessible hospital within 9 additional counties in which one or more other hospitals are present at a substantial distance from a local community. 28 of Cal.